Kidney cancer. 1. Introduction. Kidney cancer is a malignant disease that originates in the tissues of the kidney, an essential organ responsible for blood filtration, waste elimination, and fluid electrolyte balance. It typically arises from the renal cortex, with renal cell carcinoma, RCC, being the most common type. Kidney cancer can grow silently without symptoms in early stages, often discovered incidentally during imaging for unrelated conditions. As the tumor enlarges, it may invade local structures, spread through blood vessels, or metastasize to distant organs. Improvements in diagnostic imaging and targeted therapies have significantly changed the management and prognosis of this condition. Definition. Kidney cancer is defined as a malignant neoplasm originating from renal tissues, most commonly from the epithelial lining of renal tubules, renal cell carcinoma. It is characterized by uncontrolled proliferation of abnormal cells, which invade surrounding tissues, impair renal function, and may spread metastasize via lymphatic or hematogenous routes. #3. Etymology, kidney, derived from Middle English kaidenai, from Old English kwi, womb, plus ei, egg, organ-like, reflecting its shape. Cancer, derived from Latin cancer, crab, used by Hippocrates to describe tumors with claw-like spread. Renal, from Latin renalis, meaning pertaining to the kidney. Epidemiology, global burden. Kidney cancer accounts for 431,000 new cases and 179,000 deaths worldwide annually, Globocan 2020. Geographic distribution, higher incidence in developed countries, North America, Europe, due to lifestyle risk factors and increased imaging detection. Age, most cases diagnosed between 50 to 70 years. Sex ratio, men affected 2 times more than women. Mortality, accounts for 2% of all cancer deaths globally. Trends, increasing due to better detection, but mortality rates stabilizing with new therapies. 5 types. Renal cell carcinoma, RCC, 90% of kidney cancers. Clear cell RCC, 70 to 80% associated with VHL gene mutations, highly vascular. Papillary RCC, 10 to 15%, multifocal, associated with MET gene mutations. Chromophobe RCC, 5% arises from intercalated cells, better prognosis. Collecting duct RCC, very rare, highly aggressive. B. Transitional cell carcinoma, TCC, 6-7%. Originates from the lining of the renal pelvis and ureter. C. Wilms tumor, nephroblastoma, pediatric tumor, usually before age 5. D. Renal sarcoma, rare, arises from connective tissues of the kidney. E. Other rare types, oncocytoma, angiomyolipoma, benign, but may mimic RCC. 6. Causes. The exact cause is not fully understood, but multiple genetic and environmental factors play roles. Genetic alterations, mutations in tumor suppressor genes, VHL, P53, oncogenes, and growth factor pathways. DNA damage from carcinogens, tobacco, industrial chemicals. Chronic kidney injury, dialysis, polycystic kidney disease, increased cellular turnover. Hormonal imbalance, insulin-like growth factors, sex hormones. Immune dysfunction leading to failure of tumor surveillance. 7. Risk factors. Lifestyle, smoking, doubles risk. Obesity, hormonal and inflammatory mechanisms. Hypertension, independent risk factor. Medical conditions, chronic kidney disease, long-term dialysis. Acquired cystic kidney disease. Genetic syndromes, von Hippel-Lindau, VHL disease. Birt-Hogg-Dubé syndrome, hereditary papillary RCC. Occupational exposure, cadmium, asbestos, trichloroethylene, petroleum products. Family history of kidney cancer. Male sex, older age. 8 complications. Local complications, obstruction of urinary tract, hydronephrosis, renal vein thrombosis, hypertension due to renin secretion. Systemic complications, paraneoplastic syndromes, hypercalcemia, PTHRP secretion, polycythemia, excess erythropoietin, anemia, decreased EPO, chronic disease, fever and weight loss, cytokine mediated. Metastasis, lungs, most common, cough, hemoptysis, bones, fractures, pain, liver, hepatomegaly, jaundice, brain, neurological deficits, renal failure if both kidneys affected or after nephrectomy. Number 9, pathophysiology. 1. Initiating event, genetic mutation, commonly in VHL gene on chromosome 3p. 2. Loss of VHL function, accumulation of hypoxia-inducible factors, if. 3. Overexpression of VF, PDGF, and TGF-I, angiogenesis, and tumor growth. 4. Uncontrolled proliferation of renal epithelial cells, tumor formation. 5. Tumor invades renal capsule, perinephric fat, renal vein, inferior vena cava. 6. Hematogenous spread to lungs, liver, bone, and brain. 7. Secretion of abnormal hormones, paraneoplastic syndromes. 10. Signs and symptoms, classic triad. Hematuria, blood and urine, flank pain, palpable abdominal mass, but present in only 6-10% of patients. Other symptoms, weight loss, fever, night sweats, fatigue, anorexia, hypertension, renin secretion or renal artery compression, anemia or polycythemia, varicocele, especially left-sided due to renal vein obstruction, bone pain, cough, or neurological symptoms, metastasis. 11. Medical diagnosis, clinical evaluation, history, physical exam, laboratory tests, urinalysis, hematuria, CBC, anemia, polycythemia, electrolytes, renal function tests, serum calcium, hypercalcemia, imaging, ultrasound, screening, CT scan with contrast, gold standard for staging, MRI, useful if CT contraindicated, chest x-ray, bone scan, metastasis evaluation, biopsy, percutaneous renal biopsy when diagnosis is uncertain, staging, TNM classification, tumor, nodes, metastasis. 12. Nursing diagnosis. Acute pain related to tumor growth or post-surgical intervention. Risk for infection related to immunosuppression or surgical procedure. Anxiety and fear related to cancer diagnosis and treatment. Impaired urinary elimination related to obstruction or nephrectomy. Imbalanced nutrition, less than body requirements. Fatigue related to disease and cancer treatment. Disturbed body image related to surgical scars. 13. Medical management. Surgical management, curative and localized disease, partial nephrectomy, nephron sparing, radical nephrectomy, kidney plus adrenal gland plus paranephric fat lymph nodes, targeted therapy, tyrosine kinase inhibitors, sunitinib, pazopanib, sorafenib, VEGF inhibitors, bevacizumab, mTOR inhibitors, everolimus, temsirolimus, immunotherapy, checkpoint inhibitors, nivolumab, pembrolizumab, ipilimumab, interleukin-2, interferon alpha, less used today, radiotherapy, palliative for bone or brain metastasis, chemotherapy, limited role, RCC is chemo-resistant. 14. Nursing management, preoperative care, assess renal function, educate patient, relieve anxiety, postoperative care, monitor urine output and fluid balance, pain management, wound care, prevent infection, monitor for bleeding, deep vein thrombosis, respiratory complications, long-term care, promote hydration, healthy diet, monitor for recurrence, metastasis, emotional and psychosocial support, patient teaching about medications and lifestyle modifications. TASHM 15, treatment options, surgical, radical, or partial nephrectomy, ablation, cryoablation, radiofrequency ablation for inoperable patients, active surveillance for elderly comorbid patients with small tumors, targeted therapy, anti-VEGF and tyrosine kinase inhibitors, immunotherapy, checkpoint inhibitors, combination therapy, targeted plus immunotherapy, palliative care, symptom control, quality of life. 16. Psychosocial intervention, provide emotional support, counseling, and stress management, educate about treatment, prognosis, and lifestyle modifications, encourage participation in cancer support groups, address body image concerns post-surgery, provide vocational, financial, and family support, spiritual care for patients who desire it. 17. Prevention, lifestyle measures, stop smoking, maintain healthy weight, control hypertension, occupational safety, avoid harmful chemicals, cadmium, asbestos, dietary habits, more fruits and vegetables, less red processed meat, medical surveillance, genetic counseling and screening in high-risk families. 18. Conclusion. Kidney cancer is a serious but increasingly treatable malignancy, most often detected as renal cell carcinoma. Although the exact causes remain unclear, risk factors such as smoking, obesity, hypertension, and genetic predisposition play major roles. Clinical presentation can be silent, with diagnosis often incidental. Advances in surgery, targeted therapy, and immunotherapy have improved patient survival. Effective nursing care, psychosocial support, and preventive lifestyle modifications are essential in comprehensive management. Early detection remains key to improving prognosis and reducing complications. Thank you. Have a nice day.